Hello, and thank you for joining me as we take a tour through the pancreas. In 1 Corinthians chapter 12, God tells us that He has arranged the members in the body, each one of them as He chose, that the parts of the body that seem weaker are indispensable, and on those parts of the body that we think less honorable, we bestow the greater honor, and our unpresentable parts are treated with greater modesty. The pancreas is one of those organs that we don't think about. We think about our hair, our skin, maybe our muscles. We think about the outward, but we don't spend a lot of time thinking about the inward appearances. The pancreas is small but mighty, and God has given it great honor. The pancreas is a small organ, as I said. It is about 6 inches long, and it lies just behind the stomach at the level of the L1 and L2 vertebrae. It's broken into 4 segments called the head, the neck, the body, and the tail. The head of the pancreas, as we can see, is nestled into the C shape of the duodenum. It has a small little extension called the uncinate process. We then move up into the neck. The neck is at the level of the pylorus of the stomach. The body then continues on towards the lateral of the body on the left side. The body then reaches into the tail, which goes out towards the spleen. The tail is allowed quite a bit of motility. The entire pancreas is covered in a covering called the peritoneum, a protective coating. The only part of the pancreas that does not have this protective covering is where the neck and the body merge. In this area, there's a great deal on the posterior surface of large blood vessels such as the aorta and the superior mesenteric artery. It is because of that the pancreas does not have peritoneum there, as it maintains contact with those major vessels. The pancreas has vasculature provided mostly through the splenic artery. The splenic artery comes off of the celiac trunk and just runs along the top of the pancreas. The splenic artery then branches into the dorsal pancreatic artery and the transverse pancreatic artery. These arteries form many arcades or anastomoses back and forth with the splenic artery, wrapping the body and the tail of the pancreas with blood vessels. The head and the neck are provided fresh oxygenated blood through 2 different ways. The gastroduodenal artery branches off into the anterior and posterior superior pancreaticoduodenal arteries. And on the lower half of the head and neck, a vasculature is provided from a branch of the superior mesenteric artery called the anterior and posterior inferior pancreaticoduodenal arteries. The veins run right along with the arteries and are named in the same way. Additionally, the lymphatic vessels follow along with the blood vessels. So you have lymph, you have veins, and you have arteries all running together throughout the pancreas in the same pattern. The lymphatic vessels, however, empty into lymph nodes primarily along the splenic artery, a few along the pylorus, and those empty into larger lymphatic nodes along the celiac trunk and along the aorta. The pancreas is innervated primarily by the vagus nerve. It also has a branch called the splanchnic nerve. But the vagus nerve is the primary innervation and has branches coming off of the T6 through T10 vertebrae. The pancreas is a 2-function organ. It provides an endocrine function and an exocrine function. Its exocrine function is digestion, while its endocrine function is glucose regulation within the blood. In terms of the exocrine, acinar cells in the pancreas monitor the production of enzymes such as lipase, amylose, and protease. These acinar cells are found along ducts within the pancreas. There's the main pancreatic duct and an accessory duct of the pancreas. These 2 ducts will then merge with the bile duct at a location called the pancreatic ampulla, or you previously called the ampulla of Vater. And this ampulla dumps into the duodenum. The acinar cells are attached directly to the duct so they can secrete their enzymes directly into the pancreatic duct, which then flows and merges with the bile and then flows into the duodenum via sphincters, that are made of smooth muscle, so that it controls the amount of enzyme that is released into the duodenum, as well as prevents the duodenal juices from backflowing into the pancreas. The endocrine function is performed by cells called the islet cells, which are a multifaceted cell that are found throughout the pancreas. They are not directly attached to the pancreatic ducts, but they're freestanding. We can see pancreatic islets here are large globular-shaped cells. And the pancreatic islets are made up of 4 different cells: alpha cells, beta cells, D cells, and PP cells. The alpha cells are responsible for the production and release of glucagon, which is important in the elevation of blood glucose levels. They make up about 20% of each islet. When the body detects that the blood glucose is getting low, the glucagon is triggered and released. Glucagon stimulates processes such as glyconeogenesis, which is literally the production of new glucose, and glucolysis, which is basically just breaking down fats from the previously broken down fatty acids that have become glycerol and forming new glucose. This is done with the liver. This provides usable glucose flowing through the bloodstream that the body can then use, which elevates the blood glucose level. However, when this happens, the glucose floating through the blood cannot be utilized until insulin is released. This brings us to the beta cells of the islets of the pancreas. The beta cells are responsible for production and release of insulin, and insulin is essentially an escort molecule. It escorts glucose to the cells and allows it to transport and pass through the cell membrane and be used for energy. Without insulin, glucose cannot be utilized by skeletal muscle or adipose tissue. This is because when insulin binds to the surface of the cells, it causes a cascade within the cell that ultimately leads to phosphorylation of vesicles within the cell. These vesicles, once phosphorylated, travel to the cell membrane and bind with insulin, which allow glucose to diffuse into the cell and be utilized through glycolysis for the production of ATP. Without insulin, this process cannot occur, and glucose will just continue free-floating through the blood. D cells, or delta cells, make up about 4% of each pancreatic islet. The delta cell is responsible for producing and releasing somatostatin. Somatostatin is an inhibitory hormone that inhibits the release of glucagon or insulin as needed. Finally, PP cells make up about 1% of the pancreatic islets, and they are a very little known cell. All we know at this point is that they are involved in appetite, and they are released during times of fasting or after a meal. But beyond that, they are still under research. The pancreas is affected by a wide array of pathologies, the primary ones being pancreatitis, pancreatic cancer, and diabetes mellitus. In pancreatitis, it is literally an inflammation of the pancreas. This is most often caused by a blockage of either the bile duct or the pancreatic duct. There's 2 different types of pancreatitis, chronic and acute. Acute pancreatitis is brought on suddenly and very quick onset, and is most often caused when a gallstone flows down through the bile duct and blocks off the ability at the pancreatic ampulla of the pancreatic juices to exit the pancreas. This causes a buildup of all those digestive or enzymes in the pancreas, which then makes the pancreas begin to slowly eat itself. And what happens is you're affected with stomach pain, nausea, vomiting, and occasionally jaundice. However, if it is not treated quickly, it can lead to systemic shutdown called shock. And if it remains untreated at that point, it can result in death. Chronic pancreatitis, however, is more hereditary, and it is usually brought on by traits such as alcoholism. In chronic pancreatitis, it's a buildup over time in which the pancreatic enzymes become activated in the pancreas prior to leaving and prior to entering the duodenum. This causes things very similar to acute pancreatitis, except that it occurs over a longer period of time, which makes it so that the pancreas is still trying to produce digestive enzymes, but it is still eating itself at the time, which wears itself out. So you have a completely exhausted pancreas that can no longer function, but is still being eaten by its own products. Chronic pancreatitis is also often brought on by cystic fibrosis. In cystic fibrosis, the mucosa, or the mucus that is in the body, becomes very thick and sticky. And this thick and sticky mucus blocks the ducts, prohibiting the pancreatic juices from exiting. This is, again, very similar to when a gallstone blocks it, but it is usually a slower process because the mucus can leave, it just is very, very slow. And again, pancreatitis is characterized, whether it's chronic or acute, by severe stomach pain, nausea, loss of appetite, vomiting, and occasionally jaundice. Pancreatic cancer is characterized by all the same symptoms, therefore making it very hard to diagnose, especially because those symptoms are not solely limited to things with the pancreas. As a matter of fact, when we see things like stomach pain, the pancreas is not one of the things that pops into our mind. However, pancreatic cancer is extremely dangerous, and it affects about 5 out of 100,000 Americans per year, according to Johns Hopkins. It is also the 4th highest in mortality rate out of the cancers found in the U.S. Pancreatic cancer is very difficult to diagnose because of the symptoms being so nonspecific. And additionally, because there are so many lymph nodes in the pancreas, it's very easy for the cancer to metastasize and spread. Only 10% of pancreatic cancers are discovered prior to metastasis. This makes it so that the pancreatic cancer is very hard not only to diagnose but to treat, because you're not only treating the pancreas, but you're trying to treat wherever it's spread to. And it doesn't respond well to treatment, contributing to its high mortality rate. Diabetes mellitus is another very common and unfortunate disease of the pancreas. It is specifically a disease of the beta cells, in which insulin is not produced in type 1 diabetics, or in type 2 diabetics, the body becomes unable to recognize that there is insulin present. Type 1 diabetics, previously called juvenile diabetes, are required to take synthetic insulin in order to have the glucose utilized by the body. In both types of diabetes, the person exhibits excessive thirst and urination because there's a buildup of glucose in the bloodstream. The body attempts to take in more fluids and flush the sugars out of the body, which then puts a strain on your kidneys. And it can also be characterized by excessive hunger because despite the fact that there's glucose present, the body is unable to utilize that food and we feel hungry. Type 2 diabetics can often be controlled by diet and exercise, but not always the case. In one of the most common complications of diabetes mellitus in type 1 or type 2 is hyperglycemia, or a high blood sugar. This high blood sugar causes damage primarily to the vessels and the nerves of the body, causing blindness, neuropathy, necrosis, and atherosclerosis, among many other symptoms. If untreated, it can cause severe damage to the body. Additionally, if diabetes is allowed to go untreated for a long time without the introduction of insulin to the body, whether it be through synthetic insulin or a healthy diet that is able to return the pancreas to a homeostatic state, the body will begin to burn adipose tissue for fuel, which sounds great, doesn't it? We're going to burn fat for fuel, but it's not great because it produces ketone bodies, which are very acidic, and causes a state called ketoacidosis, which is very dangerous and can lead to diabetic coma and death. Diabetes is not a disease to mess around with, but it can be treated and it can be handled well. As I said, with type 1 diabetics, they need to make sure that they are taking a synthetic insulin and maintaining a proper diet and a healthy lifestyle. Whereas with type 2 diabetics, it can be controlled by simply maintaining a healthy diet and being active, but often that's not the case. They need to take an oral medicine or sometimes insulin as well. Clearly from the pancreas, we can see that God has made a mighty work in a tiny organ, and we can truly praise him as we see in Psalm 139 that God has knit us together in our mother's womb, and we are fearfully and wonderfully made. Praise him for his infinite knowledge and wisdom.